Hi, my name is Cathy Patterson-Sterling and I'm the Director of Family Services for the Sunshine Coast Health Center with today's question of the week. Today's question of the week comes from Glenda, and her question is, Cathy, my husband is not motivated to go to meetings. Does that mean that he's not going to make it in recovery? So to answer your question, Glenda, I think it's important to look at the full scope of what recovery is. When we're looking at recovery, recovery is not an event, it's a process. Recovery is also a journey. And what is really critical with that is that recovery is not just the absence of using drugs and alcohol, but it's really about an entirely new recovery lifestyle. So people are looking at reaching out and connecting to something greater than themselves. They're also looking at creating healthy habits. They're expanding to having a recovery support team that helps them as well. Now, people can individually define their recovery, but it's so important to have a recovery program. There's healthy habits along the way. Each week there's a number of safeguards that people put in place, so when they're having emotional triggers or cravings to want to use and drink, if they start bargaining with their addiction, picking and choosing which substances they should be able to use or not use, they start getting into stinking thinking, catastrophizing situations, they need to have people around them who will help and support them. Meetings are very important because there's the sense of connection as well. But if people are not going to have meetings, then they need to be working their recovery in some way. They can't just continue on as things were. So having a counselor, meeting with a group of positive-minded people, being accountable, socially connecting, finding ways to be able to get perspective back again, bouncing ideas off of people. The worst thing for people in recovery is to be in isolation and to believe the lies that they may tell themselves, or getting on those distorted, cognitive distorted thinking, stinking thinking trains of thought that can happen. So that's why meetings are important, but they aren't necessarily a sign that a person's not going to make it in recovery. A person needs an entire recovery lifestyle. Thanks so much for your question. Take care.